On the basis of that interview, we reached the conclusion for ourselves, what are the most important problems of the patient? What are the highest priorities? What do we think he or she needs to treat? What are we willing to do in the treatment to help the patient get better? And we asked the patient, what are the patient's motivations in all cases? What does the patient expect from treatment? And the patient's expectations may coincide with ours or not. If the patient's expectations don't coincide with ours at all, probably that's a bad situation to start treatment. There needs to be at least one important issue that the patient wants to treat and improve, and that agrees with what we think needs to be treatment and improved. Some commonality of motivations, although it doesn't it doesn't need to be a total overlap of motivations, but there has to be some coincidence, some coinciding of what the patient wants and we want. Often patients come to treatment with very vague expectations. They say, I want to know myself better. I tell the patient, what is it you want to know better? And why do you need to psychological treatment? Don't we all want to know ourselves better, and we try to get to know ourselves throughout life? So we challenge the patient. Although the patient says, I want to have better relations with people. I would ask a patient, what do you mean better relation? What is it that you would like and that you now can't achieve? So we try to become as concrete as possible, and in the process see whether there really is such motivation. For example, one patient said, I want to improve my relationship. It was a narcissistic personality with a total incapacity to get involved with any woman. So we asked, what do you mean by getting? He said, I want to feel freer in social conversations. So I said, is that the most important issue in your social life? He said, yes. I said, what about your incapacity at age 35 of having ever been involved with any woman? Is that an issue? He said, yeah, you are right, but I'm not concerned about this. So I said, well, is it a major problem even if you are not concerned about it? So that was the beginning of a conversation. You see a case where his major motivation was totally unrelated to what seemed to me clearly the major motivation for treatment. So this is an important aspect of TFP.